Well, good morning. This is Mark Edelman, speech-language pathologist, and welcome to the Teaching of Talking. This video is going to be about the chaos of aphasia. And what happens is that when something drastic happens, there's a state of confusion. And I think there are many people who really understand that. A person has all of a sudden a severe illness or a severe trauma, and they have never been in a situation like that. They don't know where to turn, so they go to a hospital, and people are telling them all kinds of things, and they're trying to remember what they're being told, and they are going to therapy, and there's a big shock because possibly in the case of aphasia, the person isn't talking. So there is a whole lot of information that an individual has to obtain. In some cases, there's a paralysis or paresis in the upper extremities, or sometimes the person can't walk, or they have trouble swallowing, or they have any number of difficulties. And a family has never had an experience like that before, usually, and doesn't really know what to do. So they have to really rely on the professionals who are there in the system. And so there is sort of a disorder, there's sort of a disorder. There's a disorder in the household because the loved one is possibly out of work, is not home, is not able to do the checkbook, is not able to do the things that he or she always did. And so it's real chaos. It's not a laughing matter, but it's true. And so what happens? So a rehabilitation program then develops. Now, there are at least 3 or 4 disciplines that are called in to lend a hand. There's the occupational therapy, there's the physical therapy, and there's the speech therapy quite often. Not in all cases, but often there is. And so what the therapist has to do is the therapist has to make an assessment and determine what needs to be done in order to get this person back to doing normal activities as best as possible. So if there's a paralysis in the arm, the therapist is looking for ways to strengthen the arm and to get function of the arm and to get increased range of motion. The same thing goes with the legs and the feet. So if a person isn't walking, then the individual therapist, the physical therapist, then has to address it and develop a sequence of interventions that will help that person walk. So we've got the interventions that will help people walk. We have the interventions that will help people move their upper extremities, their arms, their hands, their fingers. And then there's the speech pathologist. And the speech pathologist also has to come up with a way to address speaking. And so, therefore, chaos is what happens in the beginning when everybody is surprised, everybody's really not sure what to do. Now, good therapy, and I mean excellent therapy, is something that will change the chaos to an orderly way of recovery. And so one of the things that we do as speech-language pathologists is that we evaluate speaking we develop an intervention that addresses usually talking, because talking is what the family wants and what the patient wants. And so the therapist then goes about addressing speaking. Or in many cases, there are cognitive therapies that are given. In other cases, there are old traditional ways of doing things. So what you want to make sure that you do, if you want to come out of that chaos, is you want to find a therapy that makes sense to you. And you want to find a therapy that makes sense to the individual with the aphasia. So please be very cognizant, be very aware of the individual and what he or she is reporting about the therapy, because the therapy will really help move an individual out of chaos into an orderly and sequenced way of speaking recovery. So that's the thought today. The better the staff is who is working with your loved one, the better the speech pathologist is, the better the occupational therapist is, the better the physical therapist is, then he or she, and the more experienced, he or she will develop a program that will address whatever problem is present. And not only will they address the problem, but they'll also come up with a reasonable, simple, fun way to improve each one of those areas. Now, if there's a lot of frustration or if there's a lot of upset, you're in the wrong place. Just remember that. A good therapist will always devise therapy that an individual with aphasia can achieve, and achieve with reasonably little difficulty. So remember that. If you have a good therapist, he'll always give the patient tasks that can be readily done, and tasks related to speaking. There's a lot of therapists who are doing tasks that are, again, cognitive, but they don't really address speaking. So you want to really find those therapists who are focused on getting a person talking again, even if they have an apraxia or an aphasia. This is Mark Idelman, speech-language pathologist. I hope you've enjoyed this little video today about speech therapy and about chaos and about bringing chaos, diminishing chaos, and going about a simple, easy method. And it's not always so easy, but a therapist can make it easy. And if you have an orderly way of addressing something, then depression diminishes, anxiety diminishes, anger diminishes. And the last thing I want to say also is, for the caregiver, sometimes they're in a state of chaos too. And if somebody takes the time with you or with the caregiver to explain things, to teach you slowly and gradually and easily what to do in the situation, then the care partner or the spouse feels a lot better, because they're given the tools to help the individual, so that the individual doesn't have to be angry, so that the individual doesn't have to be depressed or withdrawn. This is Mark Idelman. If you've liked this video, please give us a thumbs up. And underneath the video, you can find our website at teachingoftalking.com. You can also find our Facebook page, which we hope you'll join us in the community. You'll also see a link so that you can get free videos every week that will help explain different aspects of aphasia. And Lastly, there is a questionnaire. So if you would like to have mentoring, if you're a caregiver or even a therapist, and you'd like to really be walked through the procedures that will help your loved one talk, just fill that out and send it along to me, and we'll contact you and figure out a way to help you address the speaking of your loved one. So on that, the last thing, we provide in-service training to speech-language pathologists in hospitals and clinics and university. And we also can train people who have stroke clubs. We can train the membership if they want to learn about how to stimulate speech and language at home with those with aphasia. So we thank you for stopping by. Don't forget the thumbs up. Don't forget to stop by the website, and we'll look forward to seeing you next time. Bye-bye now.